In previous video, we talk about post-traumatic stress disorder, its definition, its criteria, its symptoms and diagnosis. In today's video, we will be talking about types of PTSD and its treatment. PTSD may be described differently in some situations, and the types are explained as: the first type is delayed onset PTSD. In this type, the symptoms emerge more than 6 months after experiencing trauma. This is known as delayed onset PTSD. Another is complex PTSD. Complex PTSD is caused by complex phenomena, means there can be repeated traumas or repeated losses, and that causes complex PTSD. It's more common in abuse or domestic violence and sometimes in some sudden shocking loss. One more is uncomplicated PTSD. It is linked with one major traumatic event, but it is the easiest form to treat among all the PTSD types. Means uncomplicated name is also giving us this suggestion that this PTSD is not the complicated one, so it's easy to treat. One more is comorbid PTSD. Comorbid PTSD is a blanket term for co-occurring disorders. This means it's applied when a person has more than one mental issues. Means this comorbid PTSD happens to those people who are already suffering from some other mental disorders, and then the one more mental disorder gets added into their mental illness. So these were the types of PTSD: delayed onset PTSD, complex PTSD, uncomplicated PTSD, and comorbid PTSD. If we talk about its treatment, so the treatment consists of medications and therapy. As we know that almost all the mental disorders and mental issues are addressed by both the methods, medications and therapies. In medications, there comes serotonin reuptake inhibitors to ease the symptoms of depressed mood and anxiety. It's a well-known fact when a person is in post-traumatic stress disorder, then that person experiences anxiety, experiences depression. So these medications are for that. Then there are therapies. In therapies, we have cognitive behavioral therapy to modify negative thoughts, behaviors, and emotional responses. In previous video, we have seen that in what sense and in what criteria these emotions, these negative thoughts happen to cause errors in thinking process among people who are suffering from PTSD. So this cognitive behavior is for that modification of negative thoughts. Then one more is exposure and response prevention. A talk therapy based on exposing feared or traumatic experience within safe setting in order to reduce symptoms associated with PTSD. In this process of therapy, the patient is being again and again shown or exposed to same fearful or traumatic experience, but in safe setting where the person can ventilate their emotional breakdown for that very experience, and eventually they get free from this disorder. Thank you very much. Stay tuned with Nursing World and follow me on Instagram with the name of Nursing World 21. And if you are not yet a subscriber, please go and click on the subscriber button. Thank you.